alluded earlier to some of the difficulty that nurses have in advocating for their patients, even when they
Hmm.
feel like something is wrong that's happening, because like their job could be on the line and there's a
Yeah,
hierarchy there. Yeah, so do you want to, I don't know if you want to speak to that at all.
absolutely. Because that's probably like a topic for a whole other conversation, but it like happened to me so many times where I knew things that were happening were not good. Like not safety wise, like it was all according to policy and how they did things and everything, but experience wise for the woman, like what was happening was not okay. And I very many times had a hard time speaking up. And that's kind of my nature, you know. Um, but it's also cultural because I know then I'd go to the nursing station and like maybe there was another nurse in the room. We'd talk about whatever happened and like we would all agree that shouldn't have happened. Like someone should have said so, and nobody ever says anything, right? That that part of my nursing career is very difficult for me, and it's something that's not easy to change. Like taking it, it's something like taking a doctor or another nurse or a midwife or whatever, like outside the room and like having those difficult discussions, and it takes a lot of courage. And I think sometimes I was able to do it, but not as often as I would have liked to, for sure. Yeah, but that's how we grow, you know, as professionals and as humans and all that.
Yeah, for sure. I think it's so important to talk about because um first of all, like just compassion for the nurses who keep showing up every day, even though sometimes they don't they do feel limited in their ability
Hmm.
to advocate well for their clients. And also so parents are aware that there's more going on in this system than like how do we make sure this birth is as best as it can be for this mom and this baby.
Yeah,
There's
yeah,
a lot more pressures and considerations at stake for hospital staff.
yes,
And maybe mom and baby aren't even the top of that list.
right.
And certainly the experience of the mom is not at the top of that list.
No, a
Um,
lot of places it's like, oh, healthy mom, healthy baby. Everybody should be happy just with that outcome. But like for me, that's the bare minimum. Obviously, everybody wants that, but we should level up because the way I think about it is birth, yes, it does happen a lot of the times in North America. It happens in a hospital setting, but it is very different from everything else that happens in hospitals. For the most part, it is not an illness. It is not, you know, a sickness. Like we just decided to put birth there, right? But it really doesn't belong there. That's again another topic. But you know, so I think like a lot of practitioners just have to change their mindset. You know, obstetricians aren't just obstetricians; they're also gynecologists. They're surgeons, right? They the way they're trained is like an illness with an illness mindset, you know. And not everyone's the same, but that's kind of a generalization. So it's hard to change those things, right? To change that mindset, especially in a
yeah.
hospital setting. Yeah.